Welcome to this Informed Dental Consumer presentation. I'm Dr. Beth Dorian. In this video, I'm going to offer a little more in-depth information about cavities. The more you know, the more empowered you are to make the best decisions for your health and your wallet. Most of us understand that cavities are holes in teeth caused by dental plaque. But not just any hole. These holes have a very mushy or sticky quality to them. And it's that mushy stuff that will continue to invade the tooth if left unchecked. Dental plaque is nothing more than a gooey collection of bacteria and bacterial byproducts. The bacterial species that comprise our plaque vary from person to person. Only some of these species actually cause cavities. As you may have already suspected, it's not a fair system at all. Depending on the bacteria that comprise your dental plaque, you'll end up somewhere on this spectrum of cavity susceptibility. You could be like Lucky Lorraine, who never gets cavities, or Average Joe, all the way to the extreme end, but I brush and floss every day, Kay, who seems to get cavities no matter what she does. As a side note, if you are less prone to cavities, you're not off the hook. You might be at a greater risk for gum disease. Cavity-causing bacteria love refined sugars. While sticky, sugary foods like lollipops are widely known to be bad for your teeth, simple carbohydrates like white bread, pasta, chips, or crackers can also feed these bacteria. After they enjoy a nice meal from your leftovers, they secrete a very acidic metabolic byproduct, or we could call it bacteria poop. Their acidic secretions destroy tooth structure and replace it with a sticky mush. While cavities can occur anywhere, they develop more easily in locations where plaque settles for a while. As this example shows, plaque settles in between teeth. It can also hide in pits and grooves, such as those on the chewing surface. The rationale for placing dental sealants is to prevent cavities from initiating on the chewing surface. We put resin into the grooves and create a nice, smooth ice skating rink. Cavities also develop more easily on surfaces not protected by hard enamel, such as exposed roots. Here are 3 real-life examples of these types of cavities. If you can see them this easily, that generally means they're quite big. We'd sure like to catch them a lot earlier. Cavity progression can be broken down into 4 stages. Cavities in stage 1 are very small and just at the threshold of detection. You won't feel a small cavity, and usually we can't even see them. We have to use tools to detect them. We often use a dental explorer to check for sticky spots, or we could use a cavity-detecting laser to find those sneakier ones. Dental x-rays help us find very small cavities that result from plaque settling between the teeth. Cavities show up as little dark spots. Without this x-ray, your dentist would have no idea that you had cavities, and again, you wouldn't have symptoms like sensitivity. It's also the very best time to fix the cavities. Small fillings will take care of them. Small fillings have a very low risk of post-operative discomfort or sensitivity. Here's a real-life example of small fillings. Super easy. Our patient went on the next day as if nothing happened. But life, with all of its distractions, can keep us from the dentist sometimes, and dental care ends up on the back burner. And not everyone has access to regular care. Unfortunately, tooth decay is unsympathetic. If it's not treated, it keeps plowing through the tooth. The rate of cavity progression varies significantly. But once the cavity goes beyond the enamel layer and into the dentin, it will progress. Once it does, you've reached stage 2. At this stage, often you still won't feel sensitivity. This is the second best time to fix it. We place a larger and deeper filling. The greater percentage of your tooth that must be replaced by filling material, the weaker it gets. These weakened teeth are more vulnerable to cracks, infections, or fractures. To minimize the potential for these complications, it's often wise to upgrade to a full coverage crown when you have a very large filling. The deeper the filling, the closer it is to the tooth's nerves, which are located in the pulp. As a result of that proximity, the pulp may become irritated or inflamed. And that's why there's a greater chance of prolonged sensitivity after a deeper filling is placed. A cold drink could remind you it's there. Of course, as stated earlier, the tooth probably didn't hurt at all before the filling was placed. Fortunately for us dentists, most patients understand, but not everyone. Most of these super sensitive teeth will get better in time, but sometimes they don't. Sometimes they descend into a full-blown toothache, and in that case, the tooth will need the same treatment as a stage 3 cavity. Here's a real-life example of a stage 2 cavity. In this case, we placed a very deep filling, and so far so good for this patient. Hopefully we caught the cavity in stage 2, because once we've reached a stage 3 cavity, the tooth needs a root canal. And that's because the decay has actually reached the pulp of the tooth. At this stage, believe it or not, most of the time there is still no pain. There may be some sensitivity when you eat something sweet or cold, but not always. However, the tooth is at risk for a toothache. Those excruciating toothaches develop as a result of an infection in the pulp. Interestingly, the bacteria that cause the pulp infection are different than the ones that cause the cavity, but the cavity serves as a huge portal of entry to the pulp for these infectious bacteria. When that will happen is anybody's guess, but please don't wait for it. Once a tooth needs a root canal, it actually needs at least 3 procedures: a root canal, buildup, and a crown. A root canal involves removing the diseased pulp and nerve tissue, then cleaning and shaping that empty canal space, and sealing it off with a rubbery material. That takes care of the root. Now we need to clean the top part of the tooth and replace the diseased or damaged tooth structure with a filling. After that's done, the structurally weakened tooth is covered and protected with the crown. Here's our real-life example, all repaired. Sometimes we can't tell with certainty whether or not the tooth decay actually reaches the pulp. This is when things can get a little tricky. The proximity of the decay to the pulp, as we can discern from this X-ray, is illustrated with the black and red coloring. As far as we can see on the X-ray, the pulp and the decay are not touching. But in real life, the decay may go a little deeper and the pulp might extend a little higher. X-rays are only so sensitive to pick up those color variations. We hope to resolve the issue with the filling, but once we start removing the decay, we may discover that the decay has reached the pulp. And if so, stage 3 treatment is appropriate. So we have to prepare for either possibility. If you can't get to your cavity by stage 3, it will progress to stage 4. Once the decay progresses too far, we can no longer fix the tooth, and the only option is to remove it. While these hopelessly decayed teeth never hurt badly enough to compel treatment before, they're still vulnerable to a painful infection at any time. They may also develop a chronic painless infection that can create a burden for the body's immune system. Here are remains of teeth that never hurt badly enough to compel treatment. While they're chronically infected in this case, the patient still didn't report any pain. Once again, don't wait for pain. Here's an example of the same tooth 10 months apart. The tooth went from fixable to not fixable, and it had to be removed. Luckily, in this day and age, we do have great ways to replace missing teeth. But oftentimes, the tooth replacement will be more expensive than fixing the tooth even with stage 3 treatment. So it's always best to catch the problem as soon as possible. After a dental exam, some of you may discover that you have many cavities to address. Cavities in all stages of development. But keep in mind that after you get through that initial phase of treatment, it gets a lot easier. Now that you know you are cavity prone, it's more important than ever to make regular dental visits a part of your life. You can also do your part with good home care and a diet rich in calcium and low in refined sugar. And once again, I can't overstate the importance of dental recall visits at least once every 6 months. At your recall visits, we can help prevent new cavities with professional cleanings and fluoride application. Any cavities that do arise can be treated more quickly and conservatively. With regular visits, you should not accumulate a laundry list of needs again. An issue may pop up from time to time, but it should be very manageable. I hope it's now crystal clear how staying ahead of cavities will save you a tremendous amount of time, money, and pain over the course of your lifetime. Not to mention, the outcome will be much, much better. Thank you for watching.